Hi, good evening, everyone. Thank you for joining us today. I'm Dr. Vandana. We are here today to discuss about cancer chemotherapy. Navigating chemotherapy is too much of overwhelming. We have too many questions in our heads: what to expect, what not to expect, what are the side effects, can they really lead a normal life? To address all these questions, we are here for this session, and the session is surviving chemotherapy and managing symptoms. So it's my absolute honor to introduce Dr. Neema Bhat. She's a hematologist and a pediatric oncologist with 15 years of experience and who has done 400 plus bone marrow transplants and has still been treating so many major blood disorders and cancers. And she's serving in Therrapie multi-speciality clinic, Banashankari. We welcome you, ma'am, for the
Thank
session.
you. Thank you, Dr. Vandana, for the generous introduction. Hello and welcome to all. Thank you for joining us on this session where I think we'll be talking about a very vital topic, which is chemotherapy. So, being an oncologist, hemato-oncologist, pediatric oncologist, we handle this issue on a day-to-day basis, right? Almost on an hourly basis when we are at work. So, we treat patients with blood cancer, we treat patients with solid tumors, especially in the pediatric age group. I do bone marrow transplantation, for which also chemotherapy is a vital part of the treatment that is used for bone marrow transplantation. So we get a lot of questions from patients about what exactly is chemotherapy, how they should prepare themselves, how the family, the caregiver should prepare themselves to be able to be around, patients who are receiving chemotherapy, how they should sort of take care of themselves once they go back home after completing the sessions in the hospital, and also after chemotherapy is completed, what exactly they should do to bring themselves back to a normal routine, to their pre-chemotherapy state or well-being. So these are very important questions and very, very vital information, especially for patients and their families and friends who are dealing with a diagnosis of any type of cancer. It can be solid tumor, it can be blood cancers, it can be brain tumor. So the chemotherapy, rules and regulations, the do's, don'ts, the precautions, all of those are pretty much common in between regimens. So I would love to answer it, and I would encourage you to sort of make note of things and ask questions at the end of the session, because we are going to mostly um, try to answer the most common questions, but there are of course a lot of questions that we may not be able to answer, so please feel free to sort of chime in and ask whatever doubts you have. Dr.
Okay.
Vandana, I'm ready, we can get started. Yeah.
Yes, ma'am. Thank you, ma'am. And before we jump in, I just want to say, like, whoever the audience are there, you can just drop your comments or questions in the chat section. So we'll be addressing most of the questions at the end, and we'll be just focusing on the core questions what people have. And first question is, what are the most common side effects of chemotherapy, and which one are serious?
Yes. So chemotherapy is nothing but medicines that um, reduce the rapid multiplication of cells. Okay, so cancer cells are known and they're dangerous. They cause all the side effects. They cause all our symptoms because they multiply very fast in our body. Because of their rapid multiplication, they take over normal tissues, and they don't let normal tissues function in their normal state. So chemotherapy is specifically made to target rapidly multiplying cells. So it's good that they kill the cancer cells which are rapidly multiplying, but in addition to that, they also target other cells which rapidly multiply, which are usually hair follicles. So the root of our hair, from where hair grows, our oral mucosa cells, which is the lining of cells, that covers the inner lining of our mouth, the inner lining of our food pipe, the intestine, and all of that. So, in addition to killing our cancer cells, uh, chemotherapy will cause hair fall. Again, this is not common to all chemotherapy regimens. You have to understand that there are different types of cancer. And just as there are different types of cancer, to target those different types of cancer, there are different regimens or different protocols of chemotherapy that we use. So, not all chemotherapies are the same. Not all chemotherapies have the same side effects. Chemotherapies that are intense, that are used to treat most solid tumors and also blood cancers, will most often cause hair loss. They can also cause ulcers in the mouth. It can cause ulcers in the food pipe. It can cause ulcers in the intestine throughout its entire length. The other effect that chemotherapy can have is drop in the blood counts. So blood cells are also cells that rapidly multiply. We need that side effect for treating patients with blood cancer, which is reducing blood counts. But in patients with solid tumors, say lung cancer or stomach cancer or breast cancer, the drop in blood counts is a side effect of the chemotherapy. So patients can require blood transfusions. Patients may require platelet transfusions. May be at risk for infections because of the drop in WBC counts. They may require antibiotics. Sometimes they may require admission also because of low blood counts, and if at all they have any infections during those blood counts.
Okay. Thank you, ma'am. Thank you for addressing that not all chemotherapies will cause serious side effects. And we'll be going on to the next question, ma'am. How long do side effects last after each cycle, and how long does chemo stay in the body?
Yeah, so that's again a very good question. As I mentioned, like different cancers, there are different chemotherapy regimens. So most chemotherapy regimens are given once every 3 weeks or sometimes once every 4 weeks. There are very few chemotherapy regimens that are given once a week. Like for example, multiple myeloma treatment is given once every week, but most of it is not chemotherapy in multiple myeloma. It's a lot of targeted therapy and protein inhibitors and immunotherapy and all of those things. So most often, like for solid tumors and for blood cancers, chemotherapy is given once every 3 weeks. The reason why it is given once every 3 to 4 weeks is the effect of the chemotherapy in the body on the cancer cells should be long lasting, but the a gap of 3 weeks is given so that the body can recover from the side effects. Like I mentioned, the blood counts dropping, the ulcers, the nutritional depletion of the patient, because most often you're not able to eat, the appetite drops when you get chemotherapy. So for all of that to recover and come back to its normal state takes about 3 to 4 weeks. Now, the medicine itself may last anywhere between 24 hours all the way until up to 1 week in your system. And that can still continue to cause various side effects in the background, some of which you may be able to experience and some of which may be very subtle and may be going on in the background. Like drop in the blood counts, you don't really experience it, but it's happening in the background. So it can vary widely. Most often, the chemotherapy medicines effects last for anywhere between 24 hours to up to 1 week in the body.
Thank you, ma'am. And we'll be going for the next question. Does chemotherapy hurt, and what should I expect in the days after each session?
Yeah, so this is it's sort of a myth that chemotherapy is painful. And this is usually one of the first questions that I get asked by patients and their family as well. Like, my father is so old or my mother is so old, they're in their 70s, they're in their 60s. How can they go through this pain? So the fact that chemotherapy causes pain itself is a myth. I think that comes from the movie culture that we are used to watching in the past, that chemotherapy causes physical pain. So it is actually a medicine that is given, through the IV cannula by infusion, and it goes just like IV fluids. Most often, when you're receiving chemotherapy, there is no pain. It is just like giving IV fluids, getting IV fluids, or getting medications or antibiotics through the IV cannula. So that process itself is not painful. However, because of chemotherapy, if you end up having oral ulcers, or if you have damage to the skin or tissues because the chemotherapy has escaped from the IV cannula and leaked into the surrounding tissues, that can be painful. So in general, chemotherapy does not hurt. What should
Thank
you expect in the days after each session? As I mentioned, most often reduced appetite. Some patients do complain or say that they feel a little weaker than their usual self. Sometimes they feel a little dizzy. They feel what we call neuropathy. They feel pulling sensation or weird sensation in their hands and feet. It varies really from person to person. And most often, it is not the same symptom described by any two patients. But there are things you can do to sort of combat or fight these symptoms or prevent these symptoms that we will talk about in the next few sessions, next few questions.
you. That's very reassuring, ma'am. It takes away lots of fear with people.
Fear, yeah.
And now we'll be going to the nutrition part. What should I eat during chemotherapy, and what foods should I avoid?
Yeah. So this is a general question. I would answer it also quite generally. But as I said, every regimen is different. So specific questions about your regimen, I would strongly encourage you to discuss with your oncologist or your treating doctor, because each regimen may sometimes come with some dietary restrictions. But in general, when we talk about chemotherapy medications, most of them, as I said, cause oral ulcers. They can cause gastritis. So it can cause burning sensation in your chest. It can cause burning sensation in your abdomen. So best thing we ask you to do is try to take bland foods, not very spicy, not very oily. In general, avoid spicy and oily food. Try to avoid outside foods, because that is again filled with oil and masala that can cause gastritis symptoms. And also outside food, we don't know how they've processed it, so it may increase the risk of infections and gastroenteritis. Apart from that, I would encourage that you take nutrition dense food. So take foods that are rich in proteins. Say, for example, egg whites. So they're good quality proteins and rich in nutrition, but small quantity. So the other thing is, take food in small quantities but more frequently. Because as I described, during chemotherapy or the first few days after chemotherapy, your appetite will definitely go down. You may feel slight nausea. Previously, nausea used to be one of the dreaded side effects of chemotherapy. But nowadays, with our medications, almost most patients don't really complain of nausea. They do say that appetite goes down. So the key is, you should not give up on your food. You should not stop eating. Instead, you should take more frequent but small sized meals. So if you're used to taking 3 big meals a day, cut it down into 6 or 7 smaller meals. And the meals can be as simple as 2 pieces of fruit with maybe one egg, or it may be a bowl of muesli, or it may be some granola, or maybe like just stir fried paneer or tofu or something like that. So it doesn't have to be a full meal. Focus on the nutritional part of the meal rather than the size of the meal. So it is not important that you have to have like rice, sambar, rasam. All the components of a meal are not really required for it to be called a meal. Instead, split it into smaller components. Split it into 5 6 components in a day, and make sure that you're getting protein, some amount of carbohydrates, some amount of a good amount of fiber. All of these should be vital part of your meal, and take it in the smaller sizes. But any specific dietary guidelines, any specific foods to be avoided during chemotherapy, strongly advise you to discuss it with your oncologist at every visit.
Thank you for the very practical advice on diet, ma'am. Next, we'll be going to the other question. What is the best way to manage nausea and vomiting during chemotherapy?
Yes. So, as I said, communication with your oncologist is extremely important. When we design a chemotherapy regimen for a patient, we are mostly going by the data that has been published in books, that's been published in papers, or what we have gathered from our experience, after treating so many patients. However, I believe that each patient is special, each patient is different. Okay. So, in my head, or in our experience and what we have read and treated, if I'm using a particular chemotherapy regimen, that may not lead to very severe nausea. That may be only causing mild nausea. So I may be using medications that prevent nausea to a certain extent, not higher grade. Nausea medications. But some patients tend to be very sensitive, either because of the kind of cancer they have, or just because of their general body habitus, they may be a little more sensitive, and you may experience little exacerbated or more stronger nausea and vomiting. So in those scenarios, you always, when you come back for a follow-up visit, or you take an emergency number from the doctor, you always communicate and say, after my chemotherapy, maybe 1 day, 2 days later, I had severe nausea, I had severe vomiting, or my appetite went so low that I really couldn't eat anything. So communication helps a lot. We try to ask these questions at follow-up visits, but if your doctor is not asking you if you had severe nausea or vomiting, make sure to tell them that last cycle I felt extremely nauseous, or last cycle my appetite was really poor and I really couldn't eat anything. The other thing is, try to, as I said, take smaller meals and keep it nutrition dense. Citrus or lemony stuff helps during chemotherapy to reduce nausea, vomiting. As you're getting the medicine, sometimes also chewing on ginger, mint, minty stuff, or like that ginger peppermint kind of flavored, and keeping things like polo or chewing gum or lemon with you at any point. If you feel nauseous, that helps. Taking your nausea medicines following your discharge instructions is very, very important. We see patients all the time. We would have described all our, the nausea medications, option number 1, 2, 3, and also most of us as oncologists, we would have added SOS medications. So if the prescribed medicines are not helping you and or nausea is over and beyond that, please try to take this SOS, as in, if needed, if you're feeling really nauseous, take that. So read your discharge instructions clearly, thoroughly, and make sure that you follow everything that's written in the instructions. If you miss the instructions, then you might experience more symptoms. So these are the salient things. One more thing is, don't try to eat food when it's very, very hot, because in general, most of our patients and their experiences, when you try to eat food when it's very hot, the flavors hit very strongly, and that make you feel more nauseous. So try to wait until the food cools down a little bit, maybe to room temperature, and then eat it, and that will help with mouth sores, mouth ulcers, as well, in reducing the nausea and the vomiting sensation.
Thank you, ma'am. I think these are most important tips that patients should follow so that it will be helpful for them. And the most concerning question people have is, will I lose my hair? Should I cut it short? And how do I care for my scalp during the treatment? It's the most common
Yeah.
question.
Yes, that is the most common question. And unfortunately, that's one of the most disturbing side effects of chemotherapy. As I answered earlier, yes and no. You may lose hair, and there are some chemotherapy regimens where you actually may not lose your hair at all. Like I described, multiple myeloma, plasma cell leukemia. There are a few conditions in which we don't really use strong chemotherapies that damage the hair follicles or that attack the hair follicles. So, in such patients, you will actually complete your treatment without really losing any hair or very minimal hair, mostly because of nutritional reasons. But in solid tumors or in blood cancers, almost all the patients do end up losing almost all of their hair. And what I tell my patients, because we know which are the regimens, which are the chemotherapy regimens that cause hair loss. So we usually warn the patients and tell, most likely you're going to lose all your hair. The best thing is you cut your hair short, because if you have really long hair and it's falling, down on your pillows, it is falling in your food, when you're eating it, it can be very disturbing. It is also very distressful and disturbing to watch long hair fall, because it leaves a different impact in your mind. So, as an oncologist, I usually advise the patients, cut your hair as short as possible as you're comfortable. Maybe you can go stepwise fashion, short and then shorter. And we don't really advise you to take it all off at once. That can be quite disturbing from an image perspective. But if you shorten it and then it falls, then it may be a little easier to deal with it. I like the other question where you asked, how do you care for your scalp during treatment? Very important question. Yes, we forget that scalp is nothing but skin. So once all the hair falls off, there can be extreme dryness of the scalp, especially during chemotherapy. It causes our skin to dry. So the scalp can feel very dry. So best thing is to use some oil and make sure to keep it moist. Also, our scalp is very thin skin, and it's never been exposed or rain. So try to keep it covered. Don't try to keep it open, bare, or exposed, because if it is exposed to hot sun or very cold weather, you may feel cold. Hot sun, you can get sunburn. So one advice is, since it is sensitive skin, always try to keep it covered with either a woolen hat or a cap, something, and try to avoid extreme temperature changes, because very important, otherwise it can be very sensitive, and that can cause a lot of pain.
Okay. And the next question is, how do I manage the weakness and tiredness during chemo?
Yeah, this is somehow one of the major side effects that almost all patients complain of, whether it is myeloma treatment, whether it is any other cancer that we treat for, or lymphoma, whatever, that they experience fatigue and tiredness. And sometimes it is only 1 or 2 days after the chemotherapy. Sometimes it tends to last for up to 1 week, and you just don't feel like doing your normal activities. So one of the important advice I give my patients is, yes, you're going to feel tired, but that doesn't mean that you stop moving, right? Because you stop moving, you consider yourself a patient, you just restrict yourself to the chair or bed, saying, okay, now I'm a cancer patient, I'm taking chemotherapy, I should not move. That is going to make your problems worse. So small amounts of movement every day is very, very, very important. and that actually helps you fight the fatigue, that actually helps you fight the nausea, increase or improve your appetite a little bit, and can also help you sleep better. I encourage almost all of my patients, unless they're not able to even get up or have very low counts, to always get up, go outside, try to get sunlight. Very important that you should try to get sunlight, because that has a different effect on your psyche, it has a different effect on your mood, and mood helps control your energy levels. Mood actually reduces your fatigue. Mood helps you reduce your weakness or feeling of weakness, and makes you feel a little stronger if you're able to get sunlight. On the other hand, excessive movement. So I have some patients who are extremely active, who want to go for a marathon, who want to go for long walks. I say don't do extremes. No, don't restrict yourself to the chair or bed completely, and at the same time, don't go on marathons and stuff, because in case something goes wrong during the marathon or a very long walk or run, then it may become difficult for you to deal with it. So always be mindful that you have to do things in moderation, and not really extremes. So keep moving, keep active, keep mobile, and don't restrict yourself to any excessive activity. 1 second, Dr. Vandana.
Yes, ma'am. She'll be back. Audience, I would request to stay back just a minute.
You have to be absolutely quiet, Putta. Sorry, I'm back.
Yeah. Yes, ma'am. Can we go to the next question?
Yes.
Um, how can I prevent and treat mouth sores during chemotherapy?
Okay. Yeah, another very good question. So, mouth sores happen again because of chemotherapy targeting our mucosa, or the inner lining that lines our oral cavity. So, major tips is prioritize mouth oral hygiene or mouth hygiene, right? Make sure that you brush your teeth at least twice a day, if possible more number of times. Every time you eat or drink something other than water, make sure to clean your mouth. If your doctor has given you mouthwash, make sure to use it regularly as prescribed. Try to consume not extreme temperature foods, so very cold or very hot foods can sort of predispose your mouth to ulcers, or if you already have an ulcer, it can make it extra sensitive. So try to make sure that you're avoiding extreme temperatures. For most of our patients, we put them on multivitamins or glutamine sachets, which is supposed to protect your mouth from getting bad ulcers. So make sure to again read your instructions, your discharge instructions, and follow those instructions. And last of all, communicate with your doctor. Most chemotherapy regimens should not give you very bad mouth ulcers, except for very, very intense chemotherapy regimens that we use, especially in blood cancers. So, except for those, most other chemotherapy regimens should not give you mouth ulcers. If you are still getting mouth ulcers, feel free to discuss with your oncologist, because they may have to modify the doses or add extra supplements or give you special instructions to make sure that it's not happening.
Okay, ma'am. Thank you for the actionable tips, which will be helpful for most of the patients. And we are moving to the immunity part. How do I protect my immunity during the chemo? And which fever or symptom means we should go to the hospital immediately? I mean, if we get the fever or any other symptom, should we go to the
Yeah.
hospital immediately?
Yes, so extremely important. I'll actually answer the second half of the question. Which fever or symptoms means you should go to the hospital? I'll start by saying, first of all, discuss this with your oncologist, because it depends on what chemotherapy regimen you're on. Number two, make sure to read the discharge instructions, because most oncology discharge instructions would have specified which symptoms mean you should not delay and you should call an emergency number or show up to the emergency immediately. Most of the chemotherapy regimens, top priority is fever. So anytime you have a fever that is more than 100, and it is coming back recurrently. So first time you get a 100-degree fever, make sure to communicate to the emergency number that you've been given. Make sure to tell your doctor that you're getting fevers. If the 100-degree or plus fever continues and keeps happening, then you have to definitely go to the emergency. Apart from this, severe nausea, severe vomiting, so bad that you're not really able to keep down any fluids, or even water, definitely go to the emergency. That means your nausea medicines are not working and you will require IV medications or IV fluids as well. Severe diarrhea, again, that's not responding to the SOS medications that have been given in your discharge summary. That also means you need to go to the emergency and you have to be evaluated by the emergency doctors. Apart from this, feeling extremely weak, tired, sudden loss of consciousness, sudden dizziness, sudden unresponsiveness, all of those things have to be taken seriously in patients who have a diagnosis of cancer and who are on chemotherapy. And those patients also have to be taken to the emergency immediately. So, most often, these symptoms in patients who have brain tumors, we see that a change in their responsiveness or alertness. So, patient suddenly becomes too drowsy, not able to follow commands, having seizures or fits, and sometimes not really making eye contact, talking irrelevant things, we call it altered sensorium. All of those things are the symptoms that require attention immediately, and they have to be taken to the emergency. Now, to address the first part of the question, how do you protect your immunity during chemotherapy? There's not really much you can do to protect your immunity. If the chemotherapy is so strong that it's attacking your immunity, most often we advise patients to stay in a safer zone, as in, don't go to crowded places, don't attend large functions where there are too many people, avoid any contact with other people who are sick, avoid too many visitors coming home. There is, of course, this practice in India where somebody is sick, so okay, I have to go visit them, I have to check up on them. It's genuinely out of concern usually, but what happens is if there are too many visitors, somebody is going to be sick invariably, and that sickness spreads to patients who are on chemotherapy very easily. So try to avoid the number of visitors coming home very often, because that can give you infections, number one. Number two, try to avoid temples, mosque, or places of worship, malls, markets, all of those places, because that can give you infections. Avoid eating outside, especially raw foods. Avoid eating outside foods because that can cause severe gastric and gastritis infections. Apart from this, try to eat healthy food. So if you don't eat protein rich food, if you don't eat food that is rich in nutrition, your immunity gets affected. So all of these things are very simple things most often, except for the part that you don't go outside or socialize as much. That can be difficult for patients to do. But nutrition part, trying to avoid other people who are sick, fairly simple things that you can follow. And it can be a relief not just to you, it can be a relief to your oncologist, because a lot of times we don't want to delay patients' treatment because we know that that can affect the prognosis and outcome. But we have some patients who, for some reason, keep coming back with infections. And anytime there's an infection, that means I have to postpone the patient's chemotherapy, which means the outcome of the patient or the prognosis of the patient's diagnosis will change. So be very mindful of that, because infection doesn't mean only suffering at that point from the infection. It also means postponement of your chemotherapy, which can be detrimental.
Yes, ma'am. Thank you for stressing on the red flag warning signs and how to address it and all. And we'll be going to the next question. Can I live a normal life during chemotherapy, work, family, and my daily routine at home?
Yeah, so as much as possible, we encourage our patients to try to lead a normal life, whether they're adults, elderly patients, or children. Uh, Work for a lot of patients, if you're especially doing work from home or like a screen job, then work should be possible. But if you are regularly going to the office, you have long travel periods, you have to spend, say, 8, 10 hours, at work, that may be a little challenging for patients. It still depends on what chemotherapy regimen you're on. If you're not on very strong chemotherapy regimens, it may still be possible. But traveling long hours, we usually advise to avoid, because it can be very strenuous on the body after taking chemotherapy to travel for long hours, to sit in traffic. Even for normal people, it's torture enough. So for people who are getting chemotherapy and are dealing with a cancer diagnosis, that may be difficult. As far as family goes, yes, please feel free to mingle with the family, spend time with family. That's what keeps you positive during these times. If you have children, don't hesitate to spend time with them. I have had grandparents ask, can I spend time with my grandchildren because I'm receiving chemotherapy? Unless you have very young babies under the age of 3 months, whom we would advise, don't hold, don't kiss, don't come in too much close contact with. We do advise against that, because your body is sort of secreting chemotherapy sometimes in the secretions or in the sweat or through the skin pores. So we try to avoid young children coming in contact with it because we don't know the side effects. Otherwise, for most older children, toddlers, there is no restriction for you to mingle with your family, for you to mingle with friends, in fact, as long as it's in smaller batches or smaller groups and nobody is sick. So you have to follow some precautions and be strict in a certain, in some certain ways. And if possible, as much as possible, try to wear a mask if when you're going out in public or when other people are visiting you, just to keep the risk of infection at the lowest. But by no means does it mean that you have to isolate yourself. You have to keep yourself inside a single room. You should not come out. You should live in a bubble. We are trying to slowly move out of that concept and make it more normal for the patients.
Yes, ma'am. Thank you for telling that with precautions, even they can lead a normal, regular life like others. And there is one more question that is, can I take Ayurvedic medicines, vitamins, or supplements alongside chemo? And what actually helps the treatment work better?
Yeah, great question. And I think anybody who is on treatment on chemotherapy, or anyone's family or friend who's on chemotherapy, should definitely, number one, discuss this again with your oncologist, as I always tell. Number two, try to avoid Ayurvedic medications. Try to avoid unnecessary supplements. There's nothing against other schools of medicine. It is more so that if they're not highly purified medications, I don't know exactly what chemical is in it. And a lot of Ayurvedic medications are still chemicals. They are just derived from plants and they're not highly purified like our allopathy medicines. So, as a result of that, like other medicines, these medicines or these ingredients may have adverse effects sometimes on the kidneys, sometimes on the liver, sometimes on the pancreas. Um, and they may interact with our chemotherapy medicine, sometimes even reducing the efficacy of our chemotherapy medicine. So be very, very, very mindful, very careful, and try to not take any, chudna or syrup, Ayurveda medications along with the chemotherapy. After you're done with the chemotherapy, you speak to your oncologist and discuss the medicines, discuss the supplements you want to take, and you can definitely start. Because as I said, some of these medicines are usually sold as immune boosting medications, or medicines to reduce your nausea, or medicines to give you strength and power, but we don't know what exactly is in them. So we don't want unnecessary interactions. It can lead to unnecessary side effects, organ damage, or the medicine or chemotherapy medicine not working appropriately. Then we will be left figuring out what exactly caused this and how to fix it, rather than trying to figure out how to treat your cancer. So yeah, be very, very mindful of what are the medicines you take. In general, vitamins, supplements, except for blood cancers, most other solid tumors, you should be able to take vitamins, but run it through your doctor. If possible, take your medicines. The medicines that you want to take, you take it to your doctor and make sure that they run through the ingredients and tell you that, okay, this is okay for you to take during the chemotherapy. Only then I would make sure that it is cleared and then you can take it.
Okay. Thank you, ma'am. And the last question, how do I recover and rebuild strength once chemotherapy ends?
Yes, extremely important, right? Not just to fight cancer, but to regain your life back once the fight is over, because you're fighting for life. So if you are not able to get back to that life, then what's the point of the whole fight? Um, as I mentioned, most patients will feel weaker. Most patients will feel like they have lost their strength. Mentally and physically, you will feel weaker. So mental strength, you have to try to sort of regain it back through activities like yoga, meditation, trying to focus yourself, try to recenter yourself, try to do small activities that give you joy, listen to music, read a book. You can do these during chemotherapy as well, but try to get back into your routine more vigorously after chemotherapy is over. To build your strength back, never lose your strength completely during chemotherapy. Uh, I mean, as a doctor, I usually advise my patients, as I said, to try to walk regularly, at least if you're not able to do other activities. But after you clear with your doctor, if possible, try to do small amounts of strength training or resistance. So you have to be able to handle your bones, your joints, your muscles, and make sure to strengthen them, because they also might have seen side effects of the chemotherapy. Your nutrition would have been affected because of reduced appetite. So you will have to gain that nutrition back. So start focusing back on taking a lot of protein rich food, start focusing taking on a lot of fiber rich food, a lot of sprouts, legumes, all natural based foods as much as possible, because that also helps you gain your strength back, in addition to physical activity. So small amounts of everything that is good for you: music, yoga, meditation, dance if you want to, if you're a person who's into dancing, reading, positive stuff, because mental strength is sometimes more important than physical strength. So all of these things, and there's a lot of sort of wellness programs that and more than wellness programs, there's a lot of support groups which have been formed by patients' families or patients who have gone through this journey. So feel free to reach out to them. Don't hesitate to discuss your diagnosis of cancer or your journey of cancer with them. When you discuss with other people who have been through the same journey, you may find a lot of tips, as compared to tips being given by a doctor who's only treating one sided. I'm sitting on this side of the screen and treating patients. But if you talk to someone who's been through the journey, they may be able to give you some better tips as well. So try to reach out and see if there are any support groups, and talk to those people as well.
Okay, thank you, ma'am. That was very helpful. And now we'll go to the comment section. We have some two questions. I'll read out, ma'am. My mother is diagnosed. Mother is diagnosed with the multiple myeloma. She can't bear the pain after chemotherapy. Can you suggest any patch for pain relief? From Manjula.
Yeah. So, hello, Manjula. I hear that question. So, most often, multiple myeloma comes with bony pains because the cancer cells would have attacked various bones in the body. So, unfortunately, one strip or one patch may not really help with the pain relief. I would encourage you to talk to your oncologist and ask them to prescribe pain medications. A lot of times, just paracetamol or Dolo 650 may not be enough. We may have to give stronger medicines. It's called Ultracet or Tramadol, or sometimes even morphine or fentanyl. Okay. When it comes to patches, we only have fentanyl patches available in India for strong pain relief. But it may not help in multiple myeloma patients because the pains tend to be quite diffuse. So she may need systemic pain medications. So I would encourage you to speak to your oncologist, or at least seek pain and palliative doctors help, so that they can write the appropriate medications. And I would like to clarify that pain specifically may be a little bit worse after chemotherapy, because and for multiple myeloma patients, because we are trying to heal those bony lesions, so she may feel a little discomfort. So discuss with your oncologist and they should be able to help you out.
Okay, ma'am. Before going to the next question, I request all the audience to type your questions on this chat. So we'll be addressing all the questions. And ma'am, this second question: can we eat Ayurvedic products during chemotherapy? In the same question.
Yeah. So Ayurvedic products is a very broad question, right? Ayurveda is nothing but medicine that's derived from plants. So if you look at it, even food is medicine. Okay. So you can't avoid food, obviously. But when we are talking about Ayurveda products, that may be highly concentrated, some sort of a plant derivative, or plant based chemical, which may interact with your chemotherapy, or it may cause damage to the organs like liver or kidneys or pancreas. So if you have to take some Ayurveda medicine, I would strongly suggest take those medicines, show it to your oncologist and ask them, I'm going through this chemotherapy, can I combine these Ayurveda medications or these Ayurveda products during my chemotherapy? Most often, we would say try to avoid it during the chemotherapy, but maybe 2 3 days later, after the effect of the chemotherapy has started coming down in your body, some of the products may be okay to take. I'm not giving an umbrella clearance to any product. I would still say discuss it with your oncologist, because every chemo regimen differs, and every Ayurveda product has different ingredients. It's not like all of them have the same ingredients, so it has to be still clarified with your oncologist. Feel free to take your medicine to your oncologist and get it clarified. Very small things like, some people take little extra garlic, some people take extra ginger, extra turmeric, things that you're adding to your food. Diet based variations should be okay, but anything that comes in a highly purified, highly strengthened form, in the form of churna or tablet, discuss it with your oncologist before you add it to your regimen.
If there are any more questions, I request people to type it down. I think that is all we have got, ma'am, for now. Okay. Okay, I think we can wrap it up, ma'am. And once again, I would like to thank you very much for making some time and sharing your expertise with our audience. And I think it will be helpful for all of them. And And I thank all the audience for joining us for today evening. And if you feel this is very helpful, you can share it with your family and friends so that they'll be benefited out of it as well.
Okay, thank you, Dr. Vandana. Thank you for all the people who joined us on this session. I hope you have a good night. Thank you.
Thank you, ma'am.